Hi, this is Maddie and Emily.
And this is our ER. It's called the Dallin Francos Children's Hospital. So our 5 problems in our ER are understaffing, overcrowding, labs taking a long time, children being afraid of the hospital, and radiology also taking a long time.
To fix our understaffing issue, we are going to hire more nurses, doctors, radiology techs, that type of thing. And in order to do that, we are going to send people into high schools to encourage them to work in the hospital, and we're going to have fun things within our hospital like pattern scrubs and decorated rooms, and we're going to have like therapy dogs and stuff, so it will make them want to work there.
Okay, so to combat our overcrowding issue, we have 2 waiting rooms. One's for emergent and urgent patients and one's for non-emergent patients, and we have 4 separate rooms for them to go into, like urgent care rooms for people who really don't need to be going to the emergency room.
So in order to fix our issue of lab results taking a long time, we have 2 labs in our hospital. We have one right in the middle here and then one over on the end, and we're going to hire extra lab techs. And since there are more labs and extra lab techs, the lab results will come out faster and that will take less time.
So here, in order to combat our problem of children being afraid of the hospital, we have this beautiful mural of a rainbow with some rainbow going all the way around the hospital, so you can always see it when you're walking through. And there's all these fun colors.
In order to combat our issue of radiology taking a long time, we have multiple x-ray and MRI rooms. There's an x-ray up here and an MRI, and then a CT down here and another x-ray. And since there are more of them, there won't be as long of lines of people waiting to get into them, and we will be able to do them quicker. So for innovation, we are working with the fact that kids are scared of hospitals and often don't understand medical terminology. So we're gonna have high school age students make videos that would be easy for kids to understand so that they know what's going on within the ER and maybe what's wrong with them.
Our innovation will be located in both of our waiting rooms, as you can see here and right here. So for our budget of our understaffing problem, we want to hire extra people, and the average salary for a nurse is $51,000 a year.
And since we are adding extra labs, we need extra lab techs, and their average salary is about $35,000 a year.
And for our budget of adding multiple x-ray machines and multiple MRI machines, the average cost for an x-ray machine is $84,000 a year, and the average cost for an MRI machine.
So now we're going to be showing examples of how patients move through our ER. This is our first patient. She's a 4-year-old girl, and she's complaining of trouble breathing and bouts of dizziness, and she has low blood pressure, a high respiratory rate, and mild swelling of the respiratory tract. Our patient arrives by private vehicle, and first she goes to the check-in area where she will be registered, and next she goes to the triage area where they will triage her symptoms and decide which waiting room she will go to. Since our patient is having trouble breathing, she is put in the emergent waiting room. Next, she's put in an emergency area where additional tests would be done, like a test for concussion or a pulmonary function test. Next, our patient goes to the observation area where she will get her test results, and then she will be discharged and go home.
Our next patient is a 7-year-old girl who has been vomiting for the past 2 days and is unable to hold down any fluids. She's extremely lethargic and complains of a headache, and her vomiting continues in the ER with more stomach pains. So she enters through the private vehicle entrance, and then she needs to be immediately triaged in the triage area, and then since she has very urgent symptoms, she needs to be immediately admitted to the bed. While she's in the emergency department, we found out that she has a history of Crohn's disease. While she has been admitted, she needs to have lots of IV fluids for dehydration. She needs to be given additional tests in labs to see if she has Crohn's disease or food poisoning, or just to rule out any other diagnosis. She then travels over to the observation area to get her lab results and test results, where then she would then be discharged and go home.